HeartMate 2 was first approved in 2008 as bridge to transplantation. It was developed as a new generation of the HeartMate device that has been around since mid-1990s. They thought about creating a more durable, smaller device that will last longer and will be available to more people in terms of body size. It was approved as destination therapy in 2010. Destination therapy means that patients that otherwise are not a transplant candidate because either of the age or other comorbid conditions have the ability of having an improved quality of life by receiving this device called left ventricular assist device, HeartMate 2, as the last option for advanced end-stage heart failure.
Heart transplantation, while the gold standard for treating severe end-stage heart failure, is not the answer for many, even most patients with end-stage severe heart failure. So the ability to insert left ventricular assist devices for this disease, I think is going to have more of an impact population-wise in the United States than heart transplantation has.
The device works in conjunction with the heart, is implanted via open heart surgery. It's connected to the heart via a tube, and then it basically sucks the blood out of the heart and it pushes it into the circulation via another tube that's connected to the aorta, which is the big blood vessel that travels through the body and distributes the blood to the vital organs.
It's been pretty consistently shown that the overwhelming majority of patients go into surgery in class 4 or class 3 heart failure and come out in class 1 or class 2 heart failure. Most people with heart failure are limited in what they can do, many times to the point where they can't even engage in the activities of daily living. And now individuals can re-engage in life and can do a lot of the things that they weren't unable to do typically for many years.
They only have mild limitation with extreme activities, but a lot of them can return to work, can return to doing their daily activities and their hobbies. They can go shopping, go to the movies. We had somebody that roofed their entire house. We currently have somebody out in the community that's farming full-time with a device. The device has one single limitation. You cannot go swimming with a device. You can, however, fish from the shore or in the waders. The device is completely quiet, so it doesn't interfere with your daily living activities. Overall, the device weighs less than a pound. Most of the people won't feel it. It doesn't interfere with their activities, and it is so small and it can be so well hidden that we had people actually get married with a device.
We don't know how long they're going to last. Technology is always changing. We know they are very durable, much more durable than the first generation devices.
The longest device in the United States that has lasted has been about 6 years, since the device is pretty new. However, this device can be replaced with usually an easy operation. There is no limitation into how many devices you place, short of obviously your body has to be in good shape. A lot of the patients that have been younger patients have chosen not to pursue transplantation and continue to live on these devices because of limited medications that they have to take, less follow-up, less invasive procedures, and the ability of changing this device and still receiving the transplantation at the back end if it's necessary, therefore having a higher chance of expanding their life expectancy.
A lot of times what we're finding is that individuals who may not have been candidates for heart transplantation may become candidates for transplant, and in a certain number of individuals there may also be recovery. There are a minority of patients out there who do seem to get recovery of heart function after a period of time on the left ventricular assist device.
It opens the door for improved quality of life to a lot of local patients that otherwise they will have no hope.
The results from left ventricular assist device have been improving incrementally, and so we may see the point where these devices may rival the results that we're seeing with heart transplantation, which to this day remains the gold standard.
We as medical community are able to provide patients here in Nebraska with these therapies that otherwise they will have had to travel long ways. So I think that is a great achievement for the community, and I'm proud as being part of the team at Nebraska Medical Center.